I'm Dr. Joel Beck. I'm a plastic surgeon for 15 years, and I think the goal of these series is to help educate you in a very real way from somebody who's really gone through it and from somebody who, quite honestly, had to prepare and really think about the way that I was going to operate, the type of procedures and designing them. So there's a lot that goes on both of our from both of our viewpoints. Mm-hmm. So I hope that you get a lot out of it.
And this is a part 2 of the Q&A series we're doing together, where he's going to answer all of the questions you guys have about skin removal. So the first question is, what would you tell someone who is concerned about the scars they will have?
I think that what's most important is that you focus on the end result of your surgery and what you're going to look like after you've had the multiple procedures. Unfortunately, at this point, there's not a whole lot we can do with the scars except keep our fingers crossed that the patient heals well. And Jacqueline's an amazing healer, so her scars look fantastic. But you will have multiple scars, and that's kind of the trade-off to be able to get to that point where you feel comfortable in all the clothes that you want to wear and going out. So, that's the big thing about scars. There's all kinds of different ways that scars can look either really good or not so good, but I would have you discuss that with the surgeon who you choose.
Right. And I think for me, I was never really concerned with scarring. I've always told him, do what's best, do what you need to, cut where you need to, because at the end of the day, those are just more like your battle wounds, is what I say. It's, a reminder of everything you've been through and how strong you are now at this point of your life to go through the weight loss, the surgeries, and all that. So for me, it's just a reminder of all the hard work I've done to get to this point. So I definitely wouldn't be worried about the scars that much. I know I've even been called Frankenstein. People said I must look like Frankenstein with all my scars, but I'll take it. I'm happy, I'm healthy. Mentally, I feel better. Physically, I feel better. So I would take the scars. So the next one is, what tips would you give someone considering surgery but is very nervous or scared about having surgery?
It's very normal to feel nervous and anxious about surgery, but having that relationship with your surgeon, feeling like you are not, that the surgeon's not holding anything back from you, and that you understand that there's going to be a lot of recovery and everything. And that can either be a nervous or anxiety-provoking thought, or it can be a very exciting thought. And we're trying to focus on all of the exciting things that you're going to have with your new shape and body. Mm-hmm. So.
And I know too, what helped me is I told myself, this is gonna suck, it's really gonna hurt, but I have to focus on the end result, like you said. So I think going into it knowing it's really gonna hurt, I think helped me, instead of just saying, oh, it's gonna be fine, it's not gonna hurt that bad, I'll be fine. Like, I told myself every day, like, it's really going to hurt. Like, this is going to be the worst pain you've ever been in, but it's going to be so worth it, and it's not going to last forever. So.
Let me ask you a question.
Yes.
How bad was the pain? And there's multiple operations that Jacqueline's undergone. So, how much of a part of your journey were you worried about pain versus just being able to get back out there, working out, and feeling great again?
I think definitely in the moment, it's a lot worse than I kind of thought it would be. But again, it just goes back to knowing that this is the best decision for me and my overall health, happiness, well-being. And so in the moment, you just have to really remind yourself, like, this pain is not going to last forever. And it may be really hard right now, and it might be hard not to work out or be stuck at home or not really moving as much, but it's not going to be forever. And the results and how I'll be able to live the rest of my life are going to be so worth it that I had it removed, that this little bit, like 6 weeks of pain, is worth it in the end for me. So it was very painful.
And as you can see from Jacqueline's Instagrams, is that she's out there now working out all the time, working out just as hard as she did before she even had any of these surgeries.
Right.
And this is after having multiple operations.
Right.
So this is coming from a real person undergoing real procedures,
Mm-hmm.
and she's still so motivated, and that's what I love about her.
And I think too, what really helps is that I've gone through some of the procedures, like looking down, or like not even having to like lift the skin up on your stomach to like wash things, or actually being able to see like muscle definition in your arm now. I think it's focusing on that more so. And then you're excited to go back to the gym because you can actually strengthen your muscles now, where before it was so heavy to carry the skin, it was hard to do a lot of the workouts. But now that it's gone, you're ready to get back in and do new things and feel new muscle groups and like see your abs. And so the pain is definitely worth it. It's, you know, it's worth it for that little bit of time, for a lifetime of having the skin removed, in my opinion.
Yeah, and really, as I mentioned, the activities of daily living, of just being able to get up out of bed and to put on your clothes and put on your bra or put on your underwear, um, you know, you have a lot less burden on your body,
Right.
which over time is going to be something that's really nice.
Right.
And hopefully each of you can appreciate what we just mentioned.
Right. So I know a lot of people, myself included, were worried about the drainage tubes. So if you can talk a little bit about what that is, what it's like, why they're needed, or
So these are called drains, and drains are used to remove fluid that your body naturally produces after surgery. And, you know, there's different types of tubes out there. And we've been using a tube that I think works real well. It works great as far as removing that excess fluid. And these drains are placed underneath the skin that is then closed. And your body produces this fluid, and it gets rid of that, so that way all the skin can then stick back down to uh, the anatomy below. Otherwise, you have fluid collections, which could be a potential complication. So we need drains. The drains don't have to hurt removing them, depending on the type of drain. So, you know, each time we've done this, except for the liposuction case, we use drains. And I mean, how much was it an impact on you, or how much inconvenience was it?
um, they definitely didn't hurt coming out at all. Like I didn't even feel it when you took it out.
Yeah, and a lot of people worry about removing
Yeah.
them, so that's a good thing to hear.
Yeah, like I didn't even feel it. Like I was like nervous, then all of a sudden he was done, and I was like, oh, I didn't even know you started. So that was interesting. I think with the drains, it's more mentally challenging because you see it kind of in your body as something, or you shower, you kind of have to hold them or be mindful of it. So they don't hurt, but I think mentally it's just something weird to have to see in your body or have. Um,
And to note, these drains, they're silastic tubing. They get sutured down to the skin, and then they come out, and then it's connected to a little bulb, and you squeeze the bulb to get all the air out, and you cap it, and the bulb wants to open, and when it does that, there's a negative force, or like a vacuum, and that assists the fluid to come out, so that way you can heal appropriately. So seeing that on a daily basis, I can see would be kind of hard, but you've dealt with it really well.
I think it just goes back to reminding yourself that it's only there to help you and to help you heal and recover. And again, they're not going to be in that long. Like mine were in a few days, I think.
Probably up to a couple weeks.
Probably. Yeah, I think it was more like that. You're right.
Yeah.
Yeah, mine were in for a couple weeks, but you only know that they're going to help you, and it's just going to help you heal. I was lucky because Kevin drained them for me, but that part kind of grossed me out. What is it? What comes out? Just fluid?
It's a mixture of serous fluid, which is some of the fluid that your body produces, just clear fluid, and it's mixed with some blood at first. And as you keep them in longer and longer, the drainage amount gets less and less and less, and that's how we know when we can take them out. And the color changes to kind of a more like clearish yellow fluid.
Right.
So there's less blood associated with it.
Yeah. Just something you have to remember that might suck for a little bit, but it's not going to be like that forever, and they'll come out and you'll be fine. After you have a skin removal procedure done, if you gain weight after, how does that affect your results?
Well, ideally, it would be nice for you not to gain weight. And I think that's part of the challenge as a massive weight loss patient, is to have this challenge of trying to not regain the weight that you work so hard at losing. Um, but on the other hand, when you are post-op, you can't just go and work out. And that's something that you have to kind of think about as well, because you may want to go work out immediately, but that's really not a possibility early on. So the challenge of trying to not gain the weight is there. And then over time, you actually would be expected to lose weight considering how much skin we remove. But if you do gain weight, I think that it would take good communication with your surgeon to figure out why that happened and what can we do to try to reverse that before we step into the next phase or the next operation. Because again, then you can't go work out again immediately. So that's the challenge of massive weight loss surgery, skin removal, is that there's just so many operations involved usually, that you go through these periods where you're going to be working out and then you can't work out and you can work out again, and so your body goes through a lot. That's why this is like a multiple year experience, not something that you do in just 3 months.
So is there a specific or more typical order that people go through when needing multiple procedures done? Or where do you recommend they start? Or
Normally what I focus on first is the torso, and normally the abdomen, the abdominal skin. So I focus on the abdominal skin and the back skin. The procedures that we use is very individualized for each patient. And in Jacqueline's case, we did what's called the corset trunkplasty, which really focused on the entire abdominal skin. And we even went around the backside too. So she had a lot to recover from, but she did fantastic. And so usually abdominal skins first, that's kind of sets the foundation. And then I proceed to an upper body lift where we remove the skin to the arms and, if needed, even the back. Because a lot of women or men will have these back rolls. So trying to get that fat out from those rolls is challenging, and that would be stage 2. After that, it really depends again on your anatomy and what bothers you the most. Some people may say, I want to work on my breasts because they're down to here and I want to lift them up and give them some life. Other people may not have a problem with that, and it may be that we focus on their thighs. Mm-hmm. Or maybe their thighs aren't even bad and we just stop at that one point where we just did the upper and lower body lifts. So again, very individualized.
Mm-hmm. The next question is, are you able to get pregnant after having skin removed from your stomach or having a tummy tuck, or how will surgery affect pregnancy?
So normally it depends on where you are, how old you are. Having a lower body lift, we often tighten the muscles also to the abdomen, as we do like with an abdominoplasty. So when you've gained a lot of weight, not only do you have a lot more extra skin, but you also develop this push on the underlying anatomy where you can stretch the muscles out. So when you've lost that weight, we tighten the muscles, not really tighten the muscles, but we bring the tissue attached to the muscles together to flatten out your abdomen. The question is, can you get pregnant after this? And you absolutely can. Ideally, it would be really nice if you wanted to get pregnant before, but a lot of people want to look good and meet their significant other before they just get pregnant with all the, with the loose skin. So, I feel for all the people who go through or who are in this situation. So I would say that removal of the skin from the abdomen, lower body lift, corset trunkplasty, whatever procedure you undergo, you can still get pregnant. Now, if you get pregnant afterwards, it may stretch the skin out a little bit more, or it may cause what we call a diastasis recti to the abdomen, which causes a little pooch. That being said, it's not impossible to get pregnant afterwards. In fact, you very much can get pregnant. So
And then if you did have a baby after, or get pregnant after you had it done, if like, can you work out to reflatten it, or does it, you'd have to have surgery again to?
Well, a subset of those people who underwent the procedure, who got pregnant afterwards, may not need anything anymore. They may still look great.
Right.
Even if you gain weight or lose weight, often your abdomen is still very flat. But then there's also a group of those people who unfortunately stretch their skin out again, or develop a little bit of a pooch after stretching out the muscles after pregnancy. So I think that it's important to speak to whoever your surgeon is and discuss these things with the surgeon, because it's very individualized.
And the next question, if you go through an extreme amount of weight loss, is it possible for the skin to go back without surgery, or is surgery the only way to get rid of the unwanted loose skin?
If you undergo a large amount of weight loss, it is really difficult for the skin to retract back to what it was like beforehand, because the skin, you've almost built new skin to be able to accommodate your body and your being overweight. So when you lose all that weight, the skin will retract some, but it may not do it nearly as much as you want. So most often it would require some type of skin removal. And this is the same thing for somebody who hasn't lost a huge amount of weight, just got pregnant and then delivered, and then some of those people, their skin rebounds like that and they look amazing. They're just so lucky. And then you have other people who are just the opposite. They have lots of stretch marks and thin skin, and so nobody knows for sure, but most of the time you're going to need some type of a skin removal.
Right. What happens to the skin after it's removed, and can the skin be donated to like burn victims or after that? I thought this was really interesting that I got this. So, like, a lot of you ask this a lot of times, so I thought I would ask you about it.
You know, being in a private practice, normally the skin that we remove is thrown into a biohazard bag and disposed of. I suspect that potentially it may be something where we can work with trying to contact somebody who may be able to donate it for burn victims. I know that in the past, when I used to do tummy tucks earlier on in my career, I had a guy who used to come and collect the skin from the abdominoplasties, which are tummy tucks, and they would do research on it. So, there's all kinds of different options. I think that would be something that, I could look into, or whoever you're seeing, you could ask the same questions to.
After you've lost a lot of weight and you have the skin, I get asked all the time, is that because I lost weight too quickly, or is it just because I was so heavy and lost so much that I'm left with the skin? Because a lot of people think it's because when you lose weight quickly, you're left with the loose skin, opposed to if you lose it during like a long period of time that you wouldn't have the skin.
I think a lot of it depends upon how heavy you were, for how many years you were heavy. And then how heavy were you? How much weight have you lost? For example, in Jacqueline's case, she lost 350 pounds. So that's a huge amount of weight to lose, and it would be almost inconceivable for the skin to retract back, because you lost weight, but you took how many years?
It was like 3.5.
3.5 years to lose all that weight. So, in your case, it would be almost impossible for the skin to shrink up. There are different types of procedures, bariatric procedures. It's a surgical procedure adjusting the intestines and how everything's hooked up. In those cases, a lot of those people lost a lot of weight really quick. And so from a surgical standpoint, not only are we looking at how much skin we have to deal with, but we're also looking at the quality of the skin that we are dealing with, because some people are so stretched out, the elasticity is so bad that it comes into question, how are we going to develop a procedure or structure the procedure to be able to remove the skin, close everything back up and expect that everything that's closed is going to heal well. That's from a surgical standpoint, plastic surgery standpoint, what the plastic surgeon often is entertaining. So in Jacqueline's case, because she lost so much weight, I knew that doing a standard type of an abdominoplasty procedure was not the right procedure because the perfusion of blood to her skin would be altered in that the skin may not have enough blood supply to it, and she could have real problems healing. So I reached out to some other surgeons. Alex Moya is the person who I turned to, who really inspired me and has some great techniques available. And he developed the corset trunkplasty. And the reason why I chose it is because we did not undermine the skin at all. So all the skin that was left was connected to blood vessels that were perfusing the tissue really well. And it was a testament as far as how quickly she healed, because she healed faster almost than an abdominoplasty patient who didn't lose all that weight. As a surgeon, I'm trying to look at how can I design a procedure for each person where I can have the best possible recovery, and so because the skin does lose its blood supply, or the elasticity affects the healing.
A special thank you to Dr. Beck for doing these videos with me and answering your guys' questions. I hope you found it helpful.
Thank you very much, Jacqueline, for having me, and we look to try to be of assistance to all of you undergoing or thinking about undergoing these different procedures. And this is real, this is authentic, and we hope that you enjoy watching as much as we hope, or that we enjoyed actually making this video for you.